Angel. My name is Victoria Angel. I'm a student with United States University. Today we are recording a video that's on head, eyes, ears, nose, and throat. I do need to record this video for YouTube so that my instructor can grade it. Are you okay with being recorded today?
Yes.
All right, so we're going to go ahead and get started today. So first with the HEENT is what they call it when you're addressing the head, eyes, ears, nose, and throat. We start with the actual observation of the face, and while looking at that, we're just looking for symmetry, any presence of growths, sunken areas, anything of that nature. So after visual inspection is done, we're going to go ahead and I'm going to palpate your skull, so you're going to feel a little bit of pressure. I'm just kind of feeling around for any masses, any indentations in your skull, which you don't have any, so that's a good thing. From there, we move down and we look at the eye area. What we're checking for with the eyes is to make sure that your eyelids are not covering your pupils, but that they are covering the colored iris part of your eye. Yours are doing that as well, so that's a good thing. Okay. Next, we're looking at the conjunctiva, which is the lower part of your eyelid here. We're looking to make sure it's pink, not flaming red, and not any presence of irritation, discoloration, or any signs of like discharge that's coming from that area or from your tear ducts, and yours appear to be clear right now. We're going to go ahead over here and we're going to check your frontal sinuses, so let me know if you feel any pressure.
No.
Okay, and the maxillary sinus cavity.
Good.
Perfect. Okay, so the next part of this test we're going to do is a vision exam. We're going to check your optic nerve, which is your nerve number 2. We have a miniature Snellen chart here, and it needs to be about 6 feet away since it's a smaller one. So to measure 6 feet, it's approximately 2 fist bumps length. So at this point, I'm standing at that distance. So go ahead and read this line for me.
Both eyes open?
Let's start with one eye closed.
DHJBS.
Okay, go ahead and trade other one.
EPTZO.
Okay, go ahead now, both eyes together.
CFDHJ.
Okay, perfect. So we evaluate that by with the lowest line that was red, what the number next to it is. So in one of it was 20/40. 20/20 is considered perfect vision. If there was any concern, we would then refer you off to see an optometrist. Upon completion, actually, what color is this down here?
Red.
And this color?
Green.
Perfect. We check those colors just because we want to make sure, since those are the most common colors when driving. Okay, next we're going to go ahead and do a look at your pupils. So I would dim the lights normally so it's better vision, but it's a little bit further and over some furniture, so I'm not going to do that in the video. But with this, what I'm doing is I'm checking for direct light response, and then I'll show you where the next one after that will be indirect. So starting with direct, we turn the pen light on. We're going straight over the pupil that we're looking in. So I'm staring at your right eye, looking at that with the direct light. Now we're going to start with the left and look directly at it. I'm going back over to the right, and as I shine the light into your right eye, I'm actually looking at your left eye to see for the indirect response. Okay, and I repeated that on both sides. And there was response with both. Okay, the next eye exam, portion of the eye exam is something called a red reflex. Again, the lights would be dimmed for this. So we are going to go ahead and start, I go at a 15-degree angle and safety first with this. So when I'm evaluating his left eye, I'm going to hold the tool in my left hand. And then when I'm evaluating the right eye, I will switch hands, just for safety purposes. So we start at a 15-degree angle. When it's dim, it's easier to see, but we would look for the red flash of light, and as soon as we see it, we get a little bit closer into the eye itself. And what we're looking for is the veins and arteries. We're looking for the cup, the disc, the fova, and the macular. With this, the cup to disc ratio, the cup is 1, the disc is 3, so the ratio is 1 to 3. I'm going to repeat the same side on this on your right. So if the tool is in my right hand, 15 degrees, we're coming in. We look for that red reflex. When we find it, we look a little bit closer. And again, we are looking for the cup, the disc, exactly like we did on the left. Okay, let me set this down here. Okay, we are going to also check for, I can actually use my finger. The next step, we're going to check some additional cranial nerves. So I'm going to have you at first cover one eye. Okay, I'm going to have you look right at my finger, and we're going to check your abducens nerve, and by looking left and right. Okay, go ahead and swap eyes for me. Again, we're checking the right eye now. Perfect. Okay, with that hand still covering, we're going to go ahead and check the trochlear nerve up and down. Okay, go ahead and swap eyes. We're going to do that again. Perfect. Okay, go ahead and open your eyes. I'm going to have you look at my finger here. We're going to check for for convergence and accommodation. So go ahead and look. I'm going to go closer. We're looking to see if the eyes respond by going a little bit inward, almost like a cross-eyed look. Look at my finger again. And now go ahead and look at the plant over my shoulder. And we're looking to make sure that the pupils react to light accordingly based on how close and how far it is. Okay. The next portion of the exam, and we're checking another cranial nerve. I'm going to go ahead and have you cover one of your eyes, whichever one works for you. And I'm going to move my fingers from behind to the front. Let me know when you see them.
Okay.
Okay, go ahead and swap the other eye.
Okay. Okay.
Okay, go ahead and swap back. We're going to do one more side on that one. Perfect. I forgot to do the
Okay.
other. Let's do it one more time, just to make sure.
All right.
Okay, perfect. Thank you. And that we're checking for the convergence as well. Okay, so upon completion of our eyes, we are going to move into the nose area, where we are going to look and make sure the nose is symmetrical. Again, looking for any signs of any drainage. It doesn't appear that he has any drainage or anything coming from his nose at this time, which is a good thing. We're going to go ahead and swap this out so I can put the other head on. Maybe. Operator error again. There we go. Okay. Okay. With this, again, we're looking up into the nostril area. We're looking to make sure it's pink. Moisture is present, but nothing, no signs of sores, deviation, nothing of that nature is present. Go ahead and cover one nostril for me. Take a breath in. Okay, go ahead and trade for the other one. Perfect. Now I'm going to we're going to try two different scents. We're checking your olfactory nerve to see if you have the ability to smell. So go ahead and close your eyes. And then cover one nose, or one nostril. Sorry, you only have one nose. Go ahead and tell me what you smell.
Mint.
Let's try it. Let me take this out.
Cinnamon.
Okay. Go ahead and close, open your eyes and clear it out. We're going to go to the other one now.
All right.
Close the other nostril. Okay, and what do you smell?
Oh, that's bad.
That is mint. Okay, nice and strong. All right. That'll wake you up.
Yeah.
Okay, we're going to move on to the mouth. Let me swap these out so I have them. Okay. Okay, with the mouth, we're looking externally, again, for symmetry of the lips. If there's a presence of any sores or injury to the lip area, go ahead and open your mouth for me. When we look around, we're looking for the presence of sores, blisters. We're looking at the hard and the soft palate in the mouth. We're looking for any cracked teeth, foul odor, any presence of, again, any form of injury that may have happened. Go ahead and stick your tongue out for me. Say ah. And that we're checking your additional cranial nerves, your glossopharyngeal and your vagus nerve, which is your gag reflex. I'm not going to actually gag you, but I would put a tongue depressor down to make you gag to truly get that gag response. While looking at his mouth, I also noted that his tonsils are a 1+. So they're there. They're just perfect where they need to be. Okay. With your mouth, I forgot to do this. We're going to go ahead and check for the resistance of your tongue. So go ahead and stick it out, and then when we do, you're going to put some pressure. I'm going to put this little tongue blade up against it. Go ahead and try to push your tongue. We're going to check for resistance. Go ahead. Perfect. Other side. Thank you. That's cranial nerve number 12. We're checking for that resistance there. Okay. Let me swap this out here. Okay. Next, we're going to move on to the ears. When we're evaluating the ears, I'm going to have you just turn so they can see this on camera a little bit better. Thank you. We pull gently on the helix here. Any pain or discomfort?
No.
Okay, we want to do that just to make sure there's nothing too severe going on in the ear before we start manipulating it too much. We are checking to make sure that the shape and the structures of the ear are present and there's no defects. We're checking to make sure if there's any drainage in the canal or anything externally. If there's not, then we go ahead and again safety with our scope. So we want to brace it in our hand. And we're going to put some pressure up against the patient's face, gentle pressure, just so if the head were to move, we would have some support there as well. I'm going to gently pull up on the pinna and back to open up that ear canal because he is an adult. And we look in there and we want to look at the tympanic membrane. It is pearly gray. Cone of light is at 7 o'clock. No sign of redness, bulging, or irritation within the ear canal. Okay, go ahead and turn. We're going to do the other ear. Same thing. Again, I'm going to brace the tool in my hand and brace his head so that way we don't have any accidental head movement that would cause any injury. Again, same thing, gray, pearly white. There is no wax in his ears. They're actually very clean. And the cone of light is present at 5 o'clock. Okay? All right. Okay, go ahead and come back this direction. You okay?
Mm-hmm.
Okay. While I'm looking at the front of the patient, I'm checking to make sure that the trachea is straight and in line and not deviated to the side. While I'm also facing this way, go ahead and raise your shoulders for me. Perfect. We're checking accessory nerve at that point. I'm also going to go behind you at this point to kind of feel for your thyroid area. So let me sneak back here. When we're feeling for the thyroid, we're going to feel for the thyroid cartilage, and then we feel down the 2 additional notches, and then we gently feel the thyroid. It rests on each side. Once we have that between our fingers, go ahead and swallow. Perfect. We're checking for that movement. While I'm back here, I'm going to go ahead and do a whisper test with your hearing. With that, I'm going to have you gently rub your tragus, which is the center part of your ear right here. Gently close that and rub. I'm going to make say 3 words basically. Go ahead and repeat them for me. I'm going to be about 2 feet behind you. All right.
1, 2, 3.
Okay. Other side. Let's swap them out now.
Red, blue, green.
Perfect. Okay. So that's the external, that's called the whisper test. We have one other hearing test we're going to complete, and it's actually 2, I shouldn't say 1. The first one is the Weber test. I'm going to go ahead and strike the tuning fork, and I'm going to place it on your forehead. What I want you to do is tell me if you can hear and feel the vibration symmetrically on both sides. And you can tell me.
Yeah.
Okay, perfect. Okay, now I'm going to go ahead and do what's called the Rhine test, and I'm going to again strike this, and I'm going to place it on the mastoid bone directly behind your ear. I'm going to see if sound is conducting through the bone. Let me know when you can no longer hear it.
Okay.
Okay, now listen in front and let me know when you can no longer hear it.
Okay.
Okay, we're going to go ahead and repeat it on this side. So we strike it gently on that mastoid bone back there.
All right.
Okay, and then air in front.
Okay.
Okay, and we check that, and you should be able to hear it longer through your ears because the sound is traveling different through wind versus the bone. Okay, the last section of our head exam, we're going to go ahead and palpate your lymph nodes for any signs of swelling, nodules, anything of that nature. So we start up top here, and that's the pre-auricular, and we gently kind of make circular motion. Then we come down here behind, just right below the ears, that's your tonsillar. We continue to feel, go towards the back, that's the occipital, which would be like at the base of the neck there. Yep, a little bit of a massage going on. Come back here to the front. These are your submandibles. And then the closer we get to the front, that's your submantle. We also go down along the front here, which is your anterior, as we kind of go all the way down here, checking those lymph nodes. And then you have your posterior that kind of come around the back here and along down the back. And then you have your subclavicle. We always want to make sure that we feel across the clavicle area here to make sure that we are feeling if there's any nodules or anything of that nature. Okay. All right, I think we need to do some range of motion now to check for that. So we did our accessory of our shoulder. At this point, we're going to check for flexion. So what I'm going to do is have you put your head forward. Perfect. Can you extend your head back for a little bit of extension? Perfect. We're going to check lateral movement. Go ahead and rotate left and right on your shoulders. Perfect. Good head rotation there. All right. I think that completes. I feel like I'm forgetting something. Okay. One more motion that we're going to go ahead and check for resistance of our forehead for strength and muscular. I'm going to go ahead and put my hand next to you, and I want you to go ahead and lean your head into it. Perfect. And now this direction. Okay, thank you. Okay, I think that completes our head, eyes, ears, nose, and throat exam. So thank you.
Thank you.